Is it possible gaining weight in obese towns? What if your zip code had more to do with your weight than your diet? You might be doing your best, watching what you eat, walking daily, but you're still gaining weight. The truth is, sometimes it's not your body failing you. It's your environment. Obese towns exist, and they may be silently working against your health every single day. An obese town isn't just a label. It's a real phenomenon backed by data. These are places where the obesity rate is over 35%, and in some cases even 40%. But it's not just a few scattered areas. In the United States alone, there are dozens of towns with extreme obesity rates. McAllen, Texas; Jackson, Mississippi; Huntington, West Virginia; Mobile, Alabama. In these places, unhealthy living isn't the exception, it's the norm. An obese town isn't just a label. It's a real phenomenon backed by data. These are places where the obesity rate is over 35% and in some cases even 40%. But it's not just a few scattered areas. In the United States alone, there are dozens of towns with extreme obesity rates. McAllen, Texas; Jackson, Mississippi; Huntington, West Virginia; Mobile, Alabama. In these places, unhealthy living isn't the exception, it's the norm. And then there's stress. Obese towns often overlap with economically depressed regions. Financial stress, job insecurity, poor housing. All of these factors drive up cortisol levels, a hormone that contributes to fat storage, especially around the belly. People cope with stress by turning to comfort foods, high in sugar, high in fat, and designed to deliver instant emotional relief. It's a cycle. Stress, eat, gain, repeat. And it's not just happening in America. Towns and cities in the UK, Mexico, Saudi Arabia, and even parts of South Africa are facing similar issues. Urban sprawl, fast food globalization, and sedentary jobs are creating obesity pockets all over the world. But here's the key question. Can you stay healthy in an obese town? The answer is yes, but it requires intentionality. It means meal prepping even when fast food is easier. It means walking indoors when sidewalks are unsafe. It means creating a health routine in a place where the default is disease. Your body may be surrounded by unhealthy choices, but your mind can choose differently. Success stories do exist. There are people losing weight, reversing diabetes, and living longer, all while living in towns that seem designed for the opposite. The difference? They became aware. They stopped blaming themselves and started blaming the system. And from there, they made different choices. So if you're living in one of these places, if you feel stuck in a body that's changing and a town that isn't, know this: you're not broken. You're reacting to an environment that's pushing you in the wrong direction. But with the right awareness and actions, you can push back. Your health doesn't belong to your town. It belongs to you. Obesity is no longer just a personal health issue. It's a global epidemic. Over 1 billion people worldwide are now classified as overweight or obese. That includes 650 million adults, 340 million adolescents, and 39 million children, according to the World Health Organization. Let that sink in. Children as young as 5 are now developing conditions that were once reserved for older adults. Type 2, diabetes, high blood pressure, fatty liver disease, all showing up in pediatric clinics. In cities like London, New Delhi, and Riyadh, schools are adjusting cafeteria menus and gym hours in a desperate attempt to combat the rising numbers. And it doesn't stop at health. Obesity is costing countries billions every year. The U.S. alone spends an estimated $173 billion annually on medical costs related to obesity. In China, obesity-related diseases are threatening to overwhelm a healthcare system already strained by an aging population. In developing nations, obesity now coexists with malnutrition, a double burden that cripples both progress and budgets. This crisis is not confined to borders. In Australia, nearly 2/3 of adults are overweight or obese. In South Africa, urbanization has shifted diets towards sugary, processed foods. In Brazil, fast food chains have spread faster than public health education. From the rice bowls of Asia to the breadbaskets of Europe, the same enemy is hiding in plain sight. Ultra-processed, hyper-palatable, addictive food, and the built environments that support it. And the emotional toll? It's immense. Obesity often leads to low self-esteem, depression, anxiety, and social isolation. People living in obese towns or societies often face shame and discrimination in the workplace, in healthcare settings, even in relationships. It creates a cycle of emotional eating, withdrawal, and further weight gain. The physical effects are devastating. Obesity increases the risk of over 50 chronic diseases: heart disease, stroke, type 2 diabetes, several cancers, breast, colon, liver, sleep apnea, osteoarthritis, kidney disease. These aren't just risks. They're realities for millions who are caught in systems that promote unhealthy living and profit from it. And the future? Without urgent change, it's grim. Projections show that by 2035, over half of the global population could be overweight or obese. Children today could have shorter lifespans than their parents, not because of war or poverty, but because of what they eat and how they live. But here's the hope. Awareness creates resistance. When people know how their environment, food systems, and social networks affect them, they start to fight back. Cities like Amsterdam have reversed childhood obesity through aggressive policy, healthier school programs, and improved urban design. In Japan, government health initiatives promote walking, mindful eating, and community accountability. And obesity rates remain some of the lowest in the world. You don't need to move to a healthier country to be healthy. You need to move smarter, inside your kitchen, inside your mind, and inside your daily choices. It starts by looking around and asking, is this environment helping me thrive or slowly making me sick? If your answer is the latter, change your plate, change your pace, and eventually change your place. Your health isn't just personal, it's political, it's environmental, and most of all, it's possible. If this video helped you understand your environment better, give it a thumbs up and share it with someone who might be struggling in silence. And don't forget to subscribe for more videos that challenge the norms and fight for better health. No matter where you live, stay aware, stay intentional, and stay in control.